So this is a patient who was suffering from chronic HCV and had an end-stage renal disease because of chronic glomerulonephritis caused by both HCV and cryo. He developed this kind of blistering skin lesions that have become scars like this, especially in the sun-exposed areas, typical example of a porphyria cutanea due to HCV. Because PCT is a photosensitive condition and happens in sun-exposed areas including the face and the limbs. And then there is another patient with chronic hepatitis C virus infection who had developed these blistering skin lesions that is getting transformed into scars and disfiguration because this is photosensitive, and again this is an example of a porphyria cutanea. And this is a patient who had a skin lesion which is very typical of lichen planus. Why I'm calling it as lichen planus? Because you can see these fine dots and lines which are shiny within the lesion, on the surface of the lesion. These are nothing but Wickham's stria. And if you do biopsy, which is the gold standard for diagnosis of lichen planus, you're going to see hyperkeratosis, wedge-shaped hypergranulosis, sawtooth retipex, and band-like lymphocytic infiltration. Characteristic tetrad of biopsy findings in lichen planus. You can confirm. And this is one of the manifestations of chronic HCV. And this is an example of cryoglobulinic vasculitis producing typical palpable purpura. And this is a typical example of cryoglobulins presence. Remember, cryoglobulins are gamma globulins, immunoglobulins only, but they are going to precipitate at lower temperature. So you need to incubate the serum at 4 degrees C and you can see the precipitation. And how long you need to incubate? It ranges from 24 hours up to 7 days. Depending on the levels of cryoglobulins, you might need to incubate up to 7 days also. But when you increase the temperature to room body temperature, that is 37 degrees C, they redissolve and there is no trace of precipitation. And that's why they are called as cryoglobulins. They are just immunoglobulins but have a special property of getting precipitated at low temperature, that's all. And what are the different types of cryoglobulins we have? So we have type 1 cryoglobulinemia, and we have type 2 cryoglobulinemia, and we have type 3 cryoglobulinemia. Type 1 typically happens in patients who are having monoclonal gammopathies like MGUS or Waldenstrom's macroglobulinemia or multiple myeloma. Remember, the cryoglobulin levels will be very, very high, more than 5 milligrams per deciliter. And it's easy to pick up these cryoglobulins. And the clinical feature that they're going to cause is not vasculitis, they're going to cause hyperviscosity features, usually like thrombosis and headache, blurring of vision, chest pain, shortness of breath. So hyperviscosity symptoms are the main features in type 1 cryo. And what will be the characteristic picture? You will have only one form of immunoglobulin, monoclonal immunoglobulin. It could be IgG or IgM or any type of immunoglobulin, but it will be monoclonal. And type 2 cryo, on the other hand, will be typically due to infections. Please understand, the single most important infection is hepatitis C virus, and it's going to cause type 2 cryo only. And the most common type of cryo is type 2 cryo only. It's also called as mixed cryo because you're going to see a monoclonal IgM plus a polyclonal IgG. This monoclonal IgM has a rheumatoid factor activity as well. So you see monoclonal rheumatoid factor in type 2 cryo. And because you see IgM and IgG both, you have monoclonal and polyclonal, it's called as mixed. And the cryoglobulin levels will be still high, more than 1, but not very high like type 1. Typically, they're going to end up with vasculitis features. Apart from infections, CTDs and malignancies like CLL also can result in type 2 cryo, but the single most important cause is hepatitis C virus. Remember, in the world, the most common cause of cryo is HCV only. 65% of the patients with cryo are due to hepatitis C virus only. Cryo is equal to HCV, HCV is equal to cryo. That's how you need to go about in exams. Type 3 cryo, on the other hand, is typically due to CTDs, even though it can happen due to infections like HCV and even HIV. HBV can also produce type 2 and type 3 cryo. But in CTDs are the most important cause, and malignancies can still produce type 3 cryo also, but still contributions are the most important. And it's also called as mixed cryo because you're going to have polyclonal IgM, and this will have rheumatoid factor activity, and they tend to have polyclonal IgG as well. The levels of cryoglobulins will be very little here, less than 1 milligrams per deciliter, and of course they are also going to end up with vasculitis only. Clear? This cryoglobulinic vasculitis can result in development of glomerulonephritis also, and many other conditions like skin problems, musculoskeletal problems, lung involvement, or multisystemic involvement can happen. But remember, HCV produces typically type 2 cryo, and that is the most common type of cryo in the world, and most common cause of cryo in the world is hepatitis C virus only.